There's a concern in the sense that if it were to spread, it's consequential.
Mohammed Munir is a professor in virology and viral zoonoses at Lancaster University in the UK. Professor, thanks so much for giving up your Sunday evening to help us understand what's going on. Joe Biden says we should be concerned. How concerned are you?
Well, I think the matter of the fact is that since the first identification of monkeypox in 1958, this is the largest outbreak of monkeypox virus outside Africa. We shouldn't take it light because the disease spread pattern is a lot more different than what we normally see. And it is already have infected dozens of countries, and more countries are reporting this one, and more cases will come in. So we certainly have to be vigilant. For instance, in the UK, we have 20 cases already, and tomorrow the fresh data is going to be released. And I am almost certain that there are new cases. And the major issue is that at the moment we are having a community transmission. For instance, cases in the UK, we have not identified a person that has a direct link to travel from Africa or with the contaminated bedding or any of the other source that is responsible for the monkeypox spread. So certainly there is a lot to watch, and more importantly, because the disease is not being seen and observed outside the Africa on a larger scale, we don't really know how it will run its course in Europe and in America.
You just mentioned infected bedding. Does that mean it's through touch that it spreads, or does it also spread through the air?
So when a person would develop a clinical form of the monkeypox, it would have a blisters. Those blisters have a pus in there. When they are bursted, that will leave a scar onto the body. And this bursted blisters are the one that can contaminate the bedding and linens and of the belonging of the person. And that is the way it usually spread from one person to another person. And actually, this is not very different than the smallpox and the chickenpox. I mean, during war zones, most of the cases in the smallpox, when the contaminated linens being used to spread the infection. So this is one of the major route of transmission, particularly in the clinical stages of the disease.
And what about cures? Is there one specifically for monkeypox, or doctors using some other sort of medicines?
Well, at the moment, we don't have a specific treatment. Usually the disease is mild. It doesn't require much of the treatment, but mainly the treatment is symptomatic when somebody probably need antipyretic to relieve the pain, maybe rehydration of the person, or more importantly, to have antibiotic to avoid the blisters getting bacterial infection. We do have some of the antivirals, those being tested and approved against smallpox, which has been extinct now. Very likely they are going to work, but their efficacies need to be tested. But there is no specific tailor-made vaccine for the monkeypox, but the vaccine against smallpox would have a certain level of protection against this disease.
Mohammed, just very quickly, sorry, we are actually out of time. Would you advise people to wear masks and use those antiseptic hand gels on their hands?
One of the way this virus spread is a close contact. Wearing mask would certainly help you protecting from monkeypox as well as COVID.
Okay. Mohammed Munir, thank you so much indeed, professor at Lancaster University.
Thanks for having me.
Heavy floods.